Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Katanga, an urban slum in Kampala stretching about 1.5 kilometers from Wandegea to Kubiri near Bwaise. Its two zones, Busia and Chimwanyi, have a population of more than 60,000 people. Studies show that households here comprise 4 to 5 persons. The General Secretary of Chimwanyi Zone, Emmanuel Ahimbisiwe, says healthcare and the general livelihood in the slum is very poor.
Gujjudde kasasiro KCCE esobora kumara na wiki ngateje wano correctinga garbages tulina correction center.
He says with the kind of life they are exposed to, the place will never rid itself of some common diseases, especially in children.
Tutulina mazi ga government kino kitundu kiyita musweji okuva murago eyetoorode katarwiza kuba rutulina suwaje esobora kurakinga ne mixinga n'amazi g'abantu agubasena amazi ago flooding mu bantu kireetera ensiri kwekwekamu n'osanga abaana basingayo nga bari barwadde ba malaria na dysentery.
Salim Kamoga, a resident in the same area, faults the health ministry for the poor health service delivery.
Esooka esindika abantu abakugu ku byalo nga kuno bategeere kiki ekiruma abantu na kiki kye basobola okukola okubanga kwegamba basobola okuteekerateekera abantu okubeera n'ebyobulamu n'ebyobuyonjo.
Uganda has most healthcare resources located within urban centers. Wakiso and Kampala districts are host to 4 referral hospitals, Mulago Specialized Hospital, Women's Specialized Hospital, Kawempe and Chirudu referrals, and a number of other health facilities, both government and private. This deprives a sizable chunk of the population access to better health services outside the city. According to the Minister for Health, Dr. Jane Ruth Acheng, Government of Uganda continues to prioritize access to healthcare, whereby 86% of the population is now within a 5-kilometer reach of either a public or private health facility.
The ministry has upgraded over 200 health center 2s to health center 3s in a bid to ensure that every sub-county has a health facility at the level of a health center 3. This level of care provides all forms of health care during and including maternity services.
However, for Kamoga and Ahimbisiwe, living within meters away from 2 of the country's national referrals has not directly translated into improved health service.
Era ntandikira ku bakyala banu ab'ekitundu pa nakazadde kyabulabe bwafuna olubuto ng'atuuse ekiseera ky'okuzaala bw'otuuka Mulago nga toyina emitwalo 8 oba million plus tebasobola kukolako.
Ffe tuliraanye awo Mulago nze njagala okubuulira naye saawa zino wendwaza omwana ku bukiriniki bwamu oba tolina ssente nga tiweesobola tosobola kujjanjaba mwana.
When some people are able to live healthier lives and have better access to health services than others, then it is described as health equity. Health equity is the absence of unfair, unavoidable, or remediable differences in health among population groups defined socially, economically, demographically, or geographically. This is usually evaluated using the social determinants of health.
The social determinants of health are non-medical factors that influence health outcomes. There are conditions in which people are born, work, and live, which shape the conditions of daily life.
Some of these include education, unemployment and job insecurity, working life conditions, social inclusion and non-discrimination, and access to affordable health services of decent quality, among others.
Our community economy yaffe wansi nnyo era basingayo tulubatembeya obuhoteere bw'abakyala basinga omaazi ag'obuwalaba abavubuka yo mu chapati obulumu olumu buno bw'olaba nga salamu bw'ogimanyi.
To achieve health equity, it is important to invest in child survival programs, to invest in dignified lives in older age, as well as to fight to eliminate violence against women and children. But we must also pay attention to issues of the environment, climate change, the type of dwellings in which people live, work, and access critical care.
And our plans for health security have always been, do you have money to buy? Now we are realizing that even when you have money, you can fail to buy. So we need to extend our plans for health security to, can we manufacture? Can we invent? Can we invest in our scientists so that they can also make vaccines? Can we invest in the production?
Universal health coverage or a publicly funded insurance is not an issue of funding. Countries do not have to be very rich. They have to invest on the population. And the type of health services which is going to give us the best result is primary health care. A care which is looking into prevention and basic services.
Uganda has also reported a high level of out-of-pocket health expenditures, averagely 40%, which is 25 percentage points higher than the recommended World Health Organization levels for out-of-pocket expenditures.
The government continues to provide subsidies to private, not-for-profit health providers to lower the user fee, while health care is provided for free in the public health facilities since the abolition of user fees in 2001. Now I have paused here because that statement is not correct. That is the statement we always make. But me and you know that we pay for health services. Wherever you go, you pay.
I wish to take this opportunity to welcome the adoption of the health insurance bill on April 1st this year. We look forward to having His Excellency the President sign it into law soon, and we think it's an important milestone going forward.
The bill in its current form is not very popular among the investors, among the workers, among the business people, and among the private sector people. Why? Because people are saying they earn little, and yet they are the same people being requested to pay again to meet the needs of the poor.
But I must also use this opportunity to call on the government to increase its allocations to the health sector, which currently stand at an estimated 5.1% of the budget for 2020-2021. This is far below the African Union Abuja Declaration call for all African states to spend at least 15% of their national budgets on improving the health sector.
Addressing social determinants of health appropriately is fundamental for improving health and reducing long-standing inequities in health, which requires action by all sectors and civil society.
To make sure that we have a healthier population, we also have to tackle gender inequality, economical inequality, educational inequality.
Health experts advise that leaders and health actors at all levels must monitor health inequities and identify their root causes to inform policy and programs in order to improve health equity. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.